Sisters and brothers, thank you for the opportunity to join this panel discussion. I'm very sorry that I couldn't join you. An urgent matter came up that I just prevented me from travelling, but I really appreciate the invitation from the ILO and UN Women to be part of the discussion. I am the Regional Secretary for PSI, the Global Union Federation that represents workers who deliver all the public services we need. And amongst our 30 million members, health and care workers are the largest group. I just want to make a very clear point at the outset that a clear, absolute precondition in the protection of the rights of health and care workers who migrate is to ensure that workers have a voice and meaningful power in negotiating standards about the pay, conditions, and entitlements, and also in health policies that impact on them in both sending and receiving countries. And clearly one way that is done is through bilateral labour agreements and having a voice and being able to shape those agreements. And I'll come back to saying a little bit more about how we have analysed those in a moment. But let me very quickly say more broadly for the forum that PSI thinks that the forum should be framing care as a human right and also a public good. There is increasing recognition around the world of the need to frame care as a human right. And in doing so, it's very important, it's absolutely imperative that we recognise the rights of the workers who deliver care within the 5R framework of the ILO, but to also recognise that when care is a public good and a human right, the responsibility to ensure that right is realised lies with governments. Now, the rights of care workers, whether they be paid or unpaid, are closely aligned to the rights of people who require care. Both benefit when workers are unionised and when workers have a voice in shaping policy. And it's no coincidence that countries where union density is highest have some of the best health and care systems in the world. Unions can advocate for the conditions that really benefit people who need care. For example, much higher staff to patient or to care user ratios deliver much better care. But unions also advocate for greater investments in care, better training and worker education, and more respect for workers that delivers a stronger workforce and better conditions for care users. So the interests of workers and care users are aligned. What is not aligned, I think, in the perhaps some of the framework of the forum, is the need to make a profit. So making a profit from care comes at the expense of either workers' entitlements or the resources and conditions that we need for quality care, but usually both, actually. Right, now, having said that, let me go back to the bilateral labour agreements and what we've found around good practice or promising practice that needs to be developed or used as a model. So we've developed a framework that helps trade unions analyse the bilateral labour agreements, and it's based on the ILO's principles and guidelines for fair recruitment, but also the World Health Organisation's Code on International Health Worker Migration. But it's also come from our experience around what could be good practice when unions have been involved in monitoring bilateral labour agreements. And so we've had some experience with the Philippines-Germany agreement, and we've looked at other agreements on that basis. We've looked at 5 broad categories. We've looked at sort of the intent and the principles that drive each agreement. And then we go into the recruitment, the pre-departure and skills recognition, safe migration practices, who's paying fees, legal recruitment practices, how is that addressed or prevented, and outline for return of workers, and how skills are recognised and also developed prior to migration. And then the most important category for us is obviously labour rights, social protection, and the role of unions in social dialogue and having union representation in both the sending country and the receiving country. And we then look at the contribution to the public health system, and this is an area where there's a large gap, but we really think that we need to ensure that the recruitment of health workers from one country doesn't drain that health system, and that the process ends up being mutually beneficial for both in training a new workforce, a future workforce, in addressing the current workforce, and also looking at when workers, if they do return. Of course, that should always be optional, and workers should have the option to permanently migrate. We've also looked at any other provisions that might be within the agreements. Overall, there's inconsistency, to say the least. Even when countries have multiple agreements, they're very different. There's lack of clear stipulation of rights in many. One of the two biggest gaps, I think, are around the role of unions in both negotiating but also monitoring the agreements in both the sending and receiving countries. And that's something that we had, we've started with the principle that, like the Philippines-Germany agreement, there should be unions from both countries involved in the monitoring and evaluation of the agreement. But also there's a large gap in addressing the needs of the health system and really ensuring that the sending country is benefiting and not undermining their own health system. So we've found that, I know you have a speaker from the Philippines Department of Migrant Workers on this panel, and we have to recognise that they really are engaging unions through social dialogue to try and look at how they can improve their system, which is already perhaps ahead of other countries. And we do appreciate the opportunity to be part of that dialogue and to also take from that experience this learning to share with other countries. For example, we know already that we've shared this in discussion with the Australian government, who are interested in how they can improve their the migration agreements for workers coming into the aged care system from the Pacific, particularly from Fiji. And so that's been a very useful process, both for unions to learn from this database, but also for governments who are interested in upholding the rights of workers, but also at the same time upholding health systems. So thank you again for the opportunity to contribute to this discussion, and I hope we get more opportunities when I can be there face to face to advance this discussion and really collectively uphold the rights of workers. I wish you all the best with the forum.